Since the beginning of CMH in 1982, we've looked at how we develop healthcare services in our immediate service area. We started with a lot of long-term care facilities, clinics. The Cancer Center was a very big part of that. We developed our new Cancer Center in 2006, built a new facility in 2008. Our purpose was to serve those patients who had no way to get to a healthcare organization to be treated for the conditions they had. So as that volume continued to grow, there was certainly a need for those patients from outside the area that needed overnight stays.
Very soon after the Cancer Center opened, the board began to receive requests to pay for lodging as the patients received their treatments. With that in mind, the board began to look at other options, including the renovation of a house already on the CMH campus. With the hospital CEO's enthusiastic support, the board adopted the project, but quickly realized that renovation of the house was not a viable option and chose to build a new facility instead.
The auxiliary hosted a kickoff dinner where we invited community leaders, board members, medical staff, employees. After receiving our lead donation, we continued for 2 years to contact businesses, individuals, and community leaders for donations and raised $550,000, with 62% of the donations coming directly from auxiliary members and/or their spouses. The community support for this project was amazing. The local paper covered it from groundbreaking to ribbon cutting. This helped with the fundraising and the recruiting of volunteers once the project was completed.
Today, that facility, known as the Tremain Family Hospitality House, has 6 rooms and provides a haven for cancer patients and others.
As the project neared completion, the auxiliary hosted a shower. We registered all items needed with local merchants and invited the community to participate. When the house opened, it was fully furnished with donated items.
The reason I volunteer is I stayed at another hospitality house at one time, and I want the patients to feel and their family to feel the comfort and love that I received at that time.
As a retired nurse, I can still show love, compassion, and caring to our cancer patients, their family, and make them feel right at home at the hospitality house.
Our hospitality house is a focal point of the Cancer Center and the organization and the services that we provide to our community. And our staff at the hospitality house are our volunteers. The volunteers have been a big part of what we've done here. The volunteers help raise the money to pay for the facility, and they provide 24-hour, 7-day-a-week coverage for anyone staying here. They're on site. We've had over 2,000 patient days since we opened the facility in 2013, and it continues to grow. We also provide overnight stays for dialysis patients and families of patients in the hospital who are in for a longer stay than normal. So the facility really provides all the things that we had hoped for. It's a project that we're very proud of. A lot of people that we've been able to serve have benefited from it. And so I'm very proud of where we're at with this. You know, we have a great volunteer team, and they continue to do all the things they can do to support us, which we're very proud of.